Recording in progress. Ready to rock?
What are we
Okay, we'll
talking?
go in 5, 4, 3, all the way at you. You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroReset podcast. Hey, everybody. Welcome back to the NeuroReset podcast. We are lucky to have another guest with us, Dr. JD Dudum with the Back at It Decompression podcast. We are really excited to have you here today, Doc. I'd like to thank, before we get started, a couple of the sponsors that we work with. We work with XTI Lights, and today is going to be all about Dr. Dudum, what he's doing with decompression, and talk about kind of where we met, where we came from, where we are now, and just kind of the results we're getting with some of these patients. So welcome, Dr. Dudum. Glad to have you.
Thank you. I'm very excited to be here. I'm excited to talk about decomp, talk about our history, and talk more decompression, how we can help patients. Let's go.
Oh, absolutely. Okay, so my first question is, why chiropractic?
Great question. Good start. I was always interested in health. I always had a passion for helping people, the body. And what happened to me, I was very into basketball growing up, played high levels of high school basketball, was going to look at playing college, suffered some really severe injuries. This is up your alley. I had 2 concussions in the span of 4 weeks. So had really bad post-concussion syndrome, MRIs. I got frontal lobe swelling, migraines every day, sensitivity to light, couldn't focus, couldn't play basketball. So I was 16 years old, very dark time for me in my life growing up. A 16-year-old, what you would do, you'd go to the medical doctor. They would give you medication, they'd try their things. I was on 3 medications. It's been 5 months, symptoms aren't improving, and we finally switched to a 4th medication. I remember it vividly. I was in art class, I was drawing, and my whole right arm went numb as I was drawing because we just switched to medication. Side effect of the medication, nerve tingling, loss of sensation. Went to my mom and dad, like, we got to do something different. This isn't working. Something needs to be different. And as a 16-year-old, you're scared, you're nervous, your parents are scared. Someone had recommended a chiropractor. I didn't know what a chiropractor was, how to say chiropractic, whatever. We go to this chiropractor. Shout out to Dr. Athens in San Carlos. Awesome. 4 weeks later, they found out my atlas was shifted. I got hit in the head. 4 weeks later, I swear, migraines completely gone. It was a miracle. It's one of those miracle chiropractic stories. 4 weeks later, I'm like, that's what I'm going to do. I was 16 years old. That is what I'm going to do with my life. So finished. Go ahead.
I was just going to say, that's awesome.
I get chills. That was 30. That was 23 years ago. I get chills every time I tell that story. My passion since I was 16 was to be a chiropractor and was to help people that were kind of hopeless, like that they'd struggled with something. They tried, they were frustrated, and then there's no path, there's no hope. And that's where I was. And the passion for me was basketball, and I couldn't play basketball. So during our consults and exams now, we focus on, hey, what have you lost in your life? Like, what are you looking to improve, and what are your joys? How do we get you there? Went to Cal Poly, San Luis Obispo, go Mustangs, and studied nutrition. So I love talking about nutrition, food, inflammation, etc. Went to Life Chiropractic College West in Hayward. And
I've heard of it.
You've heard of it?
Yeah.
Hey, did you ever play in the pool tournament in college?
I don't recall. I don't think it was pool, it was the ping pong. I was a ping pong guy.
You were ping pong.
So for everybody listening, JD, Dr. Dudum, and I went to school together. So he was about maybe I think 2 years ahead of me. We have another mutual friend, Dr. Cam, down at San Diego Chiro Neuro. Little plug for him there. And yeah, we connected through that and had a few fun nights out in Walnut Creek, all around campus. Just a good around, all good time. But yeah, we went to
tournament too.
We had a pretty good golf tournament. Yeah. I don't remember the last couple holes, but that's okay.
Shout out to BioFreeze. You know, as students, we're always looking to get sponsors.
For sure.
Income. So shout out to BioFreeze for sponsoring us.
Absolutely.
15 years ago.
That was a good tournament. Yeah, good
We
time.
did good.
So we've got a few golf outings since then, but sorry to interrupt. All right, let's head back. So we got Life West, Chiropractic College,
Mhm. After
then
Life
what?
West, graduated 2011, started a chiropractic based practice in Walnut Creek in 2011 in December. Been doing that for 13 years. So I've been doing chiropractic work, decomp work, but overall private practice 13 years.
Very good, very good. I think I'm 2 years behind you. I got my license in 2013, actually Valentine's Day. So it's my joke that I'm my own my own Valentine's date every year. So yeah, I drove all the way down to the board here in Phoenix because I was kind of interning, assisting in the office I was in, and the girls ended up giving me cupcakes because they had cupcakes from the Valentine. Grabbed the stuff. I got my license. I got my cupcakes. Walk into work and adjust the first patient like 5 steps into the clinic.
So
So
Valentine's Day is your day.
Valentine's Day is my day. We already got the date night set, ready to rock here in about a month. So, um, cool. So, okay. Born and bred Californian, right? More
Yeah,
Northern NorCal.
NorCal,
You're currently practicing where?
Walnut Creek, California.
What's the name of your clinic?
Dudum Chiropractic, very
Okay.
original name.
Yeah, very. I hear
I don't
there's
have
some
a
other.
NeuroReset, name. It's just Dudum
Well,
Chiropractic.
you had to. I get it. Dudum was
Good
taken, so
marketing.
Dudum was taken, so I had to go with something else. So, so what else? Are there any other Dudum names we would know, in your area?
I have a very large family, Russ, Dr. Teams, and my family's doing financial services, real estate, restaurants. So it's a very large family that comes from kind of born and bred entrepreneurs where we want to start our own business, be our own bosses, and kind of control the environment that we're working in and the freedom for our families. And for me, I want to practice in a way where I dictate the rules, I dictate how patient care is based on research, clinical studies, new technologies. I don't want to be hampered by insurances and be constrained by someone or an organization telling me how to treat patients.
Yeah, and I think we both know that so many chiropractors, at least, always want to run their own practice, which is
Mhm.
great. Um, I think neither one of us really knew what it took until we actually opened the doors and we're like, wait, how much is rent? What do we have to do? There's accounting that I have to do, all the things that come along
Payroll.
with run of the, having all your policies in place. But which is one of the reasons why I ended up about 6 months before I opened up my doors here at Desert Brain and Spine. I actually got a coach, which you also might know, Dr. Bernbach. He's been working with chiropractors for 20, 25 years, trying to help them open up and run and scale so that you can have really a well-oiled machine so that you can take care of patients to the highest ability without a whole lot of fuss, so to speak. But
Yeah.
working with George has been great. I think you were a deciding factor in
You've been with him for
talking.
how long?
Gosh, I've been with him, I think this summer, maybe May will be 2 years. Yeah.
Two
So
years.
yep, 2 years.
Wow.
Started with him right after I got married. So it's pretty easy to
Now you
keep
can
track of that
remember.
one. Yeah,
That's smart.
real easy. So, let's see. So we started practicing about 13 years ago. Talked
Mhm.
about chiropractic, right? But you're doing something a little bit different now.
We
And
are.
and and it wasn't just I decided to, right? There was a reason why. So let's talk about what you're doing now, how
Yeah.
that's changed over the years, both for yourself and for your patient base. So what's that looking like?
I think it's similar to how I started in chiropractic through an experience, and I think resonates very much with your story, how you started your practice and how you've evolved, right?
Hmm.
Um, I've been practicing for 13 years. 9 years in my practice was a traditional chiropractic. We're doing adjustments. We've added some cold laser, some other modalities. I had a very significant disc bulge injury in the beginning of 2020. So I had really bad lower back pain. My left leg, my hip, my butt, all the way down to my foot was just on fire. So being a chiropractor is a very physical, demanding job. It was the first time I've ever called out sick or in pain where I couldn't practice. I was 34, 35 at the time. And it was bad. I was struggling with work. I was struggling with time with my family. I couldn't exercise. Sleeping was challenging. It was probably the second dark time of my life from a pain perspective. and contacted some colleagues that do spinal decompression. Before you started decompression, we've heard about it. I mean, most people in chiropractic, physical therapy, other modalities, they've heard
Yeah.
of decompression, but no one knows how to do it.
It's
Does
like
it
another language. Yeah.
does it work? Like,
Yeah.
it's like this unicorn up there that you heard of that never see.
Yeah.
I was desperate. I was really desperate because for me, chiropractic wasn't working, physical therapy wasn't working, cold laser wasn't working. It was get an injection or have spinal surgery. And I know the outcomes of spinal surgery. I know that when you have one, you're more likely to have a second one. I was 35, and they're not always 100%. And there's risk to getting spinal surgery.
Yeah.
I just read the stat. I don't know if I got to do more research, but 1 in 1,000 spinal surgeries are fatal.
Oh, I mean,
I've seen it a few times. And I don't necessarily want to put it out there, but I want to do more research. But I've come across that stat, and I don't know if you've seen a stat or something similar to that.
No. So one of our earlier podcasts, I want to say it's either maybe 7, 8, or 9. I had a patient, her name was Christina, and we were able to help her avoid surgery. Okay.
Okay,
But
love that.
what's interesting is when we're talking to her, she was being told originally that, hey, this is a very high percentage outcome, right?
Okay.
Hey, we've got most people that are going in. It's not usually because of pain. A lot of times it can be last ditch effort, but it's based on that peripheral nerve issue, right?
Yeah.
Their biggest concern is that you lose function of that nerve because of that compression happening at the level of the spine. And so that's what she was having for almost 2 years, year and a half about. Huge lateral herniation. She tells me, she goes, I sit in on my pre-op, which was 2 weeks after we met.
Okay.
She was actually planning to cancel, but they went on with their spiel anyway. They go, yep, 80%. We consider this 80% successful. Only for the peripheral stuff in your leg. We do not guarantee anything with pain. You probably won't have less pain in your spine. And she's like,
No
wait.
improvement for back pain.
She's
Just
like, she's
radicular pain.
bent over like 30 degrees. She's laterally translated. She literally can't move. She can't lift a laundry basket, let alone hang out with their kid, get on the ground, play with them.
Wow.
And it's a special needs child. So there's a little more associated with what's going on
Yeah.
with that kiddo, right? So, she had a hard time even going up the stairs. But anyway, the whole point of that is, you walk in and they tell you 80% success rate. They're talking about one very specific part
Of what?
of the entire thing, right? They're
Yeah.
talking about just the leg. So, and I imagine you probably did some research on that, but that is the big research that I've seen is 80% success rate on just the radicular symptoms, and maybe at best 20 to 40% for pain, which to me sounds like 60 to 80% failure rate.
Yeah, it's how you look at it.
And so the juice is not worth the squeeze 95% of the time. Talk about percentages, right?
Yeah.
But we both know what our outcomes are with decompression. So I will take decompression every time.
You at least, my thing, Doc, is, as we just said, you got to try it. I've referred, I think, 10 patients. I've been doing decompression for 4 years. I've referred 10 patients to get spinal surgery. There's been
Out of
10
how many?
patients. Well, I see 50 new patients a month.
There you go.
And I've been doing spinal decompression for 4 years.
Yeah.
So
that's what, 200, 5 or 10? That's their 5%. 95% of the time it works 95%. Every time.
And the thing, as you talk about, as I talk about, you just got to try it. Like, try it. If it's not going to work, you can still get surgery. It doesn't affect the outcome of surgery.
Yeah.
It may even improve the outcome as we create more space between the discs, rehydrate the discs, decrease inflammation. It may improve the outcome of the surgery.
Yeah. Now let's talk about kind of the surgical application compared to what we're doing with decompression, right? We've got we'll talk about the different types of injuries, the most common ones. So you're going to be able to deal with disc bulges, which are varying in size usually, and then that typically can improve or increase in severity to like a herniation, and then you have protrusions and extrusions. So let's kind of walk through that because I mean, we're seeing people across the board with all of these things. So let's get your take on what that looks like. And then after that, I want to dive into what do people do if they've already had surgery and they're having the same problem kick back up again.
Yeah. You want to talk about the differences of bulges herniations or
Yeah.
what they present with or what angle?
Let's talk about all of it, right? Because
Yeah.
we don't know what these people have until we really run an MRI. We can
Yeah,
see on an X-ray that there's decreased disc space, but we don't truly know what we're dealing with until we get proper evaluation done.
exactly. So we'll start with that. Evaluating with an MRI, if a patient's coming with radicular symptoms, there's the orthopedic testing, the straight leg raise, the slump test, where you can say, hey, you probably have a disc bulge. Doing this long enough, you and I both know that when you talk to a patient for 2 seconds or look at their review of their paperwork,
Mhm.
they probably have a disc bulge. So getting the MRI would tell us, hey, is it a disc bulge versus a herniation? So is the jelly contained in the jelly donut, or is the jelly kind of floating?
Mhm.
Um, is it an extrusion, which means that jelly's exploding everywhere? They're usually larger in size. And then are there multiple disc
Mhm.
bulges, herniations? What I have found is with a disc herniation, a disc extrusion, those are huge. I
Yeah.
mean, I'm seeing patients with 1.5 centimeters to 2 centimeters extrusions. Sorry for the listeners, but for the viewers, that's like the size of your thumbnail.
And the spinal cord is not much bigger than that.
No, because then you're talking about the thecal sac, right? That covers
Uh-huh.
the nerves. And I mean, the space is way small. It's maybe a centimeter, half a centimeter of space.
Yeah. So, what Doc is talking about is you look at the vertebral disc, right? Lives between the two vertebrae, and it kind of, you can think of it just like a jelly donut, like he was talking about, right? So the center is going to be the nucleus, and that's going to be more jelly filled. And the way that I describe it is that disc is really there to allow motion
Mm-hmm.
of the vertebral column, right? It's not necessarily a shock absorber, although it can work as one, but it's got a fibrous material around the outside and that jelly fill in the center. So if you have a big enough injury or your spine is destabilized from sitting all day, from lack of exercise, from maybe some neurological dysfunction, say a brain injury, you can lose stability in that area long enough while you're under a load, say picking up your laundry, the dog pulls the leash real hard, you're dunking over somebody, right? And you land funny. Any of these little things could cause that disc to bulge, herniate, protrude, or extrude, right?
And it may even be herniated before that, typically. And then it'll take that instant of, you know what? I went to pick up a paperclip and then boom, as
Yep.
you're saying, your back is
Mhm.
desensitized, the stabilizing muscles, they aren't engaging properly, they're delayed, and the material leaks out of the annular fibers and the disc herniates.
Yeah.
I
So
mean, it is
sprung a leak,
incredible.
so
Go
to
ahead.
speak, right? I was
Go
just
ahead.
saying sprung a leak, so to speak, right?
Yeah, the leak's there, and then boom, it explodes.
Yep. So, okay. Usually what people are dealing with is they'll have, most commonly that I'm seeing, and
Mhm.
it's probably a little different for you or the same, but these herniations, protrusions, extrusions are usually I did something and I felt it right away. I knew there was going to be a problem and boom, right? You can have one-sided pain, you can have that one-sided low back pain going to the hip, the leg, that sciatic down to like the back of the knee,
Mhm.
or you can have it go past the knee when we know for a fact we're dealing with major peripheral nerve issues. That
Yes.
nerve is being compressed. And so a lot of what we deal with is that disc bulge or that chronic herniation that's not touching the nerve, but you're still having that whole referral pattern down into that hip and that side, which everybody basically describes as sciatica, right?
Yeah.
So then they'll get prescribed PT. Okay, do your 6 to 12 weeks of PT, and then they say, hey, okay, well, we can't help you, so you got to go get injections. And then the injections may take the edge off and it comes right back. So then it's like you're like, what's left, right? We've got surgery, we've got decompression. Or I would say, come see us first before you even try anything
100%.
else. I understand people want to use their insurance, right? You're paying a lot into it, and hopefully PT does work. But usually, those like really mild issues are going to respond really favorably to PT. But when you don't, you got
Yeah.
to start thinking decompression.
100% agree. I think support what you're saying. Two things. The system's known. It's if you have the pain that we're describing, whether it's a bulge or herniation, anything like that, the formula is already written. It's PT or it's oral steroids, it's physical therapy, it's if those continue to fail, spinal injections, maybe a nerve tap, and then it's surgery. Like that's the formula.
Yep.
So if you don't succeed with the next, you go on to the next form, and you're eventually going to go down to have surgery if they're all unsuccessful.
Yeah.
We fit in is we're a great adjunct before that. So most of the cases that you and I see are, it's not, oh, I woke up and I have a stiff neck or my back's kind of achy.
Mm-hmm.
Those are not the typical decompression patients. So those patients will see our chiropractor, do some alignment issues, some structural work, just like you just hired a new doctor, right?
I did. Yep. Yeah.
Tell
She's
us
a
about
great
that.
chiropractor. Oh, so she's a really good chiropractor, got really good hands. She's been practicing for about a year, which is kind of surprising that she's able to adjust so well, in all honesty.
Yeah.
Very astute to detail, really solid at taking histories and figuring out what that problem is just from the history. And then performs a great exam. She's about halfway through the neuro program, which is excellent. So, because we do, we're a functional neurology office, but we also have decompression, like a decompression suite as part of the care that we need, right? So, as an example, I see a lot of patients with what's called dysautonomia, so irregular blood flow in the system that typically causes anxiety, dizziness, brain fog, insomnia type stuff, maybe chronic headaches and migraines, in addition to concussions, things of that nature. So a lot of these folks tend to have chronic pain, right, in the neck or the low back.
Okay.
I just saw a lady, started seeing her maybe 3 months ago, and she has 3 protruding discs at L3, 4, 4, 5, and L5S1.
Protrusions.
Protrusions, 3 different protrusions. So she's waking up every day in a ton of pain, but she's also got this dysautonomia issue. And so
How do you
she can't.
treat that?
So first, most of these folks are going to go through the ringer, the same kind of thing. They go see their primary, they get a medication, they go see a neurologist, they might see a cardiologist. Everything is normal, meaning that their heart is not the problem. It's the brain's control of basically the survival mode versus the thrive mode, right? Survive versus thrive. When we're in survival mode, we get this constriction in all of our vessels, including our brain and our body. So when that happens, we don't get all the nutrients to heal things up, right? Looking and talking to some neurosurgeons, they're saying that a vast majority of these disc issues should heal because they're going to resorb some of this disc tissue. Well, my question is, and I'm sure yours is, well, why doesn't it heal everybody, right?
Yeah.
Well, when we are in that sympathetic state, or if you're in a chronic pain situation where your fight or flight mode goes up just a bit, you're going to move further and further away from a healing state, right?
Makes sense.
So my job being a functional neurologist is to get that nervous system calmed down to the point where it can actually enter the healing state, right? So I might not start decompression right away because I know that person's going to have a harder time tolerating with all of this pain, and their nervous system is like
How long would
freaking
you wait?
Usually anywhere from 2 to 4 weeks. Some of them don't have imaging, and then we run it, and it's like, holy cow, we got to treat this too. So, that's the difference in our clinics. You're straight decompression, and you have decompression. You do the electrical modalities, the laser therapies. You do your physical exercises. The only difference in me is I would say I'm more traditionally trained as a specialist, so to speak, in functional neurology, where we evaluate the brain first, and then with our office, we just plug the tools in that the patient needs.
Got it.
And so, as far as
Makes a lot of sense.
who we focus on, we just get so many people with disc issues that we've had to bring in and create like a decompression suite.
You create your own suite.
You're right. And so we're just not a specific decompression office, right?
Yeah.
So that side of the program would be like spine reset, where the vast majority, 80, 90%, probably 80% of what we see is a neuro reset type of patient. We just plug in the spine patients as necessary, which tends to be quite a lot.
And so you're 80% neuro, and then you're utilizing the decompression to adjunct to those patients, and then also seeing some disc-based patients.
Absolutely. So usually most of the referrals we're getting are for the chronic health related issues, usually from other medical doctors, other chiropractors, other naturopaths. We're starting to get some referrals from cardiologists in the Valley, as well
That's really
as
cool.
looking to connect with, and we are connecting with a lot of orthopedic and neurosurgeons for people that aren't candidates for surgery, but they've exhausted all of their
What do you
options.
do?
So just to kind of describe what we're doing over here at Desert Brain and Spine, we're a functional neuro clinic with a pretty good handle on this decompression stuff. But I will let you guys all know that I'm calling Dr. Dudum
What?
if I'm having a difficult case, right? So with his expertise, I think he's got 6, 7 tables.
Mhm.
He actually had to expand the office because he was seeing so many decompression cases and having such good outcomes that he actually literally had to double the size of his clinic just to support the need for these people suffering.
Yeah, we doubled. We had a 2,500 square foot office, which is still
That's pretty good size
good
office.
size office. And I had 4 or 5 tables, and it was just too crammed. So we expanded across the hall. We have a 2,000 square foot decompression center.
What's the name of that center?
We call it Decompville.
Yeah, baby.
It was Decompville, was the winner. It was Decomp Center, Decompville, Decomp Land. We settled with Decompville. I think
Decomp
you voted
World.
for Decompville.
I think I did.
Yeah. And now it's everything decompression. You're 80% neuro. I'm 100% decompression.
Mm-hmm.
All I do is see decompression cases. So if it's someone that's looking for neuro, we can refer for that. But we're seeing chiropractic cases. We have a great chiropractor, Dr. Tong, excellent adjuster. He takes care of me once a week. Great at a physical exam for diagnosing the condition and how to help people. We have on-site digital x-rays if we need to find alignments with the spine, arthritis, that type of thing. So he's taking care of people on the chiropractic side. And then Decompville, like we said, 6 or 7 tables. We have 2 power plates for rehab. And all we focus on all day is spinal decompression and helping people avoid surgery.
That's awesome. That's
all we
awesome.
do.
So what's this? You mentioned the power plate. So how does that play?
Yeah.
What kind of role does that play?
When we added the power plate year and a half ago, 2 years ago, huge game changer. It's helping stabilize the lower back muscles, the posture muscles. It increases activation 140%. So if you're doing a if you're doing a bird dog, right, to strengthen the multifidus, if you're strengthening the postural muscles, if you do that on a power plate, it's going to increase activation by 146%.
That's a lot of percentage points.
Big percentage. So it's like doing them on steroids.
So what is that? What kind of outcomes or what kind of changes did you see from, say, just decomp to expanding to include this aspect?
Yeah. We will add postural strengthening exercises between 30 and 50% of improvement, which usually happens in 2 to 3 weeks.
Yeah.
I'll repeat that. A patient that's going to have spinal surgery sees us. We do our exam, we qualify them. Within 2 to 3 weeks, they should be 30 to 50% better. Those outcomes are insane for a surgical candidate patient.
Right. Somebody who's failed the corticosteroids, who's failed the PT, who's failed the injections, who may have already had a visit with a surgeon and they're considering it.
Definitely had a consult.
So the people that have failed all of that, and unfortunately insurance, they paid for it, but it didn't help.
Correct.
You're getting 30 to 50% results consistently enough to have a protocol for it.
We do it enough that that's our protocol.
That's badass.
I'll share a story in a second about one of the results that we got where the radiologist said it was magical.
Okay.
The radiologist
Let's hear it.
Cases every day. I mean, the guy sees 200, he views 200 MRIs a day. And he called our case magical.
That's pretty impressive. Did he put that in the report? Tell me he put it in the report.
Let me look I have the report. Let me see. He didn't use magical.
Dang. Well, it's not exactly medical term, but it's pretty close.
I'll circle on the power plate, then I'll tell the magical story.
Sounds good. And while we're on that radiology stuff, you have some of these, have you been running some pre and post? I mean, I started when you told me. So what
Yeah.
kind of things have you seen pre and post? Not every case needs to do it, right? Or
Mhm.
chooses to, but what's some cool stuff you've seen with that?
The coolest is the magical story, but we're doing pre and post MRIs, and we're seeing the disc bulge. Two aspects we're looking at. The disc bulge reabsorb, which if you talk to 99% of other healthcare professionals that don't do decompression, this could be chiropractors, this could be physical therapists, this could be orthopedic surgeons, this could be spinal surgeons, this could be anyone else. They will say that there's no way that spinal decompression will reabsorb a disc. Doesn't happen.
However,
the patient is okay with me sharing their name, so don't worry about the HIPAA violation.
yeah, read it to us.
This is the magic story. I guess we'll just get into it. This patient had a disc extrusion, so it's L2, L3 extrusion, right? So,
Right, so that's the jelly donut exploding.
Very clear. The jelly donut exploded. It's through the disc or the annular, and it's floating now. It went cranial, so it went up towards the head of the spinal cord. It's 1.9 centimeters by 1.8 centimeters.
So for people that are listening, right,
Mhm.
you're looking at like honestly 1 to 2 inches almost.
Yeah.
And that moved from one level at L1, L2, you said?
L2, L3, and
L2, L2.
went
It
up.
literally moved up to L1, L2. So
Yeah.
it's covering the entire backside of the vertebrae and basically touching where the next disc would be.
Yeah.
Just so you know how intense that is.
That's freaking crazy. It's
That's
huge.
nuts, dude. I mean, the
So
body's obviously resilient, but that's hard to live with.
the guy, anything you could think of for pain medication, modulation. So medications, Tylenol, over the counter. The guy could only find relief from a 10 out of 10 pain to an 8 by drinking.
Oof.
So alcohol was helping him a little bit. And so he was coming in, having a few drinks because that was the only way. Couldn't drive.
Yep.
His wife drove him, couldn't walk. We'd see him in the lobby. We'd help him get in there. I called Dr. Dudum, our radiologist. I said, "Hey, doc, I mean, this bulge is freaking huge. I want to try to help him when I do my screening, my physical exam. I will make sure that, yes, the MRI matches with the symptoms. Because as we know, I mean, 30, 40, 50% of people are walking around with a disc bulge that don't have symptoms.
Right.
So we're not just treating the MRI. We're connecting the MRI with an exam to their symptoms. That's the cause. We want to find the cause of their problem. And then we have to do some safety checks to make sure when we pull them and tug them a little bit, is it going to exacerbate their symptoms, or is it going to feel relieving to their symptoms? Because we want to make sure it's safe to do it. Call Dr. Gatterman. He's like, treat them conservatively. I agreed. I told the patient, I said, hey, this is one of the biggest disc herniations or extrusions I've ever seen. I'm going to try to help you. I'll do everything I can to help you. I need you to call a surgeon. I'll give you some recommendations. If in 3 weeks we don't dent your pain, you need to have spinal surgery. That's what I told him, because we want to take care of the patients and what's best for them. And if we're not seeing relief in 2 or 3 weeks with such a severe case, we probably would want to refer them out.
Yeah, and the reason why is pain, because it can't live like that.
Can't live like that.
2, it's going to it could potentially impact your central nervous system, right? Your spinal cord or the peripheral nerves, and you lose use of those areas of the body, right? So cauda equina syndrome would be a big one.
Exactly.
Usually, and then which is basically you lose function of your bowel and bladder, and it's not good. The other stuff is those peripheral nerves that usually go down and control your legs, right? So if you can't, drop foot, in that case, that would be more quad activity, hip flexor stuff. But that's why we have to be very diligent in what we accept, right?
Absolutely. And to the people that are anyone on the outside saying, hey, it's not safe. It could, I'll say it here, spinal decompression could not be safe. It's possible. Situations would be joint instability. If the ligaments don't hold the bones in the correct spot and the joint slides a little bit, that would be a big red flag that either A, you can't do decompression, or B, you can, but you have to modify the angle of the pull and the
Right.
weight based on where the instability is.
So we'll get back to that case, but since
Yeah,
you touched on that, so that we're talking about like things like spondylolisthesis,
yeah,
right? More traumatic, right? So like car accident,
could be.
might not want to do something like that right away till you get to maybe flexion extension films.
Exactly. We'll do flexion extension to make sure that there's no slippage. We're
Right.
talking
Yep.
spondy, retro, anterior. We're talking pars I had a consult yesterday. Guy had a pars defect,
Yeah.
right? So the bone, the pedicles, or for the listeners and viewers, the pedicles that hold the bones in place in the back, they don't allow the vertebral body to slide forward. Well, if there's a fracture, they may slide forward,
Right.
which would be really bad for the spinal cord.
Very much so.
We would want to make sure that that's not moving.
Correct.
He called in super nervous. I heard you can't do decompression with the fracture. That is true. We want to make sure the fracture's healed. So we want to, how old is it? Take some imaging to make sure there's no inflammatory response, that the healing is solid, and then take some flexion extension to make sure it's safe. We did that. It's safe. He's starting treatment next week.
Awesome.
So we want to do our due diligence on that. And that's why seeing all of these cases every day, all day makes me an expert to know if I can or cannot help you.
Mm-hmm. Yep. Excellent. That's good stuff. Okay, so let's go back to the magical case. Magic.
So we've seen this guy, and what I've learned with an extrusion, depends if it's cranial, so up towards the spine, or caudally down towards the tail, is we have to typically flex them a lot, because flexion will create the most relief with them. So when I say flexion, for the listeners, we're going to have them lay on their back and their legs are going to be close to their chest, almost like you're stretching knee to chest to really flex and open the spine. After 8 weeks with this patient, no medication, no alcohol, he was 80% better in 8 weeks. 80% better. The MRI that we took was 4 months later. We took an MRI 4 months later. The MRI report is that there was a significant interval change between the pre and the post MRI study. There is, I'll say this slowly so the listeners can understand what we're saying.
I'll translate if I need to.
There is no evidence of the extruded disc material at the L1, L2, I'm sorry, I'll repeat the saying. There is no evidence of the extruded disc material at the L2, L3 intervertebral disc level. Period. Next statement. Reabsorption of the disc material is likely. Certified radiologist report. Pre and post. Disc bulge completely reabsorbed.
Mic drop.
I dropped the pen, but
oh, that wasn't the mic. That's pretty awesome, right? And that's not the first one you've had, right?
I have right now 9 studies. So I haven't helped just 9 people, right? But 9
We've
studies.
Had 9 pre and post MRIs.
Pre and post MRIs where there is significant reabsorption. Then we're going to get into the framework of the surgical response that you got. Well, what does significant reabsorption mean? Mm-hmm. Right? I brought another MRI. This is hot off the press. This MRI is hot off the press.
Hot potato.
I got this. What's the date we're shooting this today? What's the date today?
19th. We just had our open house yesterday, so that was the
How'd
18th.
That go?
That's how I know. Oh, it went great. Had a great turnout. Oh yeah. We'll have we're actually announcing all the winners later today on social media. So you'll probably see this in a few weeks after, but yeah, all those winners, check the
What'd they win? What were you guys giving out?
We were giving away, so this light right here, there's an XTI light to my right here.
What does that do?
So what this does is, oh man, if I can break this down into a nutshell, this light technology is trying to basically reset the circadian rhythm, because everybody on the planet is light malnourished, right? For millions of years, we've spent time outdoors, rise with the sun, go to bed with the sunset, maybe read by candlelight.
Yeah.
In the last like 100 years, 200 years, very short amount of time as far as evolution goes. We're talking indoors all the time, full spectrum light, blue light, heavy, right? All the stuff
Yeah.
that's around us, these lights that are lighting me up.
Yep.
What's cool about this is blue is more for the activation of the brain, and then the red bulb is more for the calming of the brain. I had
Okay.
to put blue on just to keep up with you, Doc. So, but we've got two red panels in both of our decompression room and our
Okay.
recovery room, because the red panel or the red light has shown to not only improve melatonin production by up to 500%, it's been
Wow.
shown to decrease chronic pain from a neurohormonal and neurological standpoint, as well as improve performance and what I would say focus and attention
Okay.
with use of the red light. So most of the patients that have it right now are that have this device, they're using this and they're saying this almost has the same effect as caffeine without any of the
Wow.
crash. The opposite side is I'm sleeping better, I'm sleeping deeper, I have more energy, I wake up more refreshed, and I'm dreaming like crazy, right? So
So
that's me.
deeper sleep.
Deeper sleep.
Yeah.
So you actually repair, right? That's where we do
How
all of
do I
our
get one of
repairing.
those?
I got a guy. I
Okay.
got a guy. They're actually running a special right this second, and it should go till about the middle of November. You can get both lights for $400 from their website. I'll throw the
Okay.
link in here. But usually they're 300 each, so it saves
Okay.
$200 right now. So that's actually better than my cost, to be honest, by
Wow.
about $75.
And you use
So
both the red light and the green and the blue light daily.
daily. So
Daily.
what I'll do, patients come in from kind of a rough earlier part of the day, we'll blast them with the red. And then, oh, well, I need to go to work later tonight. Okay, cool. We'll hit you with blue before you leave. Boom, done. Recipe done.
Wow.
So,
Okay.
so what the technology is, this is actually pulsing at 250,000 times a second. 250,000 pulses in 1 second. And
Wow.
and the reason that they had to do that was because regular light is going to emit photons that fatigue our retinal cells. Okay, so they're called chromophores. These chromophores accept the light and they activate and they basically change in fatigue, right, as they use up their energy. Well, what this light does is it emits a second photon that actually turns the retinal cell back on.
Huh.
So instead of allowing it to fatigue, it basically is a light switch, on, off, on, off, on, off. And so while this light is being used, your retinal cell is essentially only on 9% of the time, but you can still see as if normal. So a way to
Wow.
say it is all that light toxicity, we can call it, around
Absolutely.
us, that's not sunlight, right? But all the light toxicity that's around us is only getting in 9% of the time, as opposed to 100% of the time.
That's huge.
So that's one of the reasons why this technology, I think they've got 65 patents on this thing, just this light.
Wow.
And so I'm jumping on board with these guys because I am seeing already significant changes in my patients because more of a neurological patient
Definitely.
base, right? I mean, 80/20, probably 90/10, but even chronic pain patients can have this. So I've got actually two 4-foot panels
They come
above
in
each of
panels.
they come in panels. Doctors are the only ones that can get that, but the
I like that.
patient can get this, right? So home use, it's portable. You screw in, screw out, that's simple.
Okay.
But you get more of an exposure with our panel with a shorter amount of time, right? Our treatment times are about 30 minutes, give or take, for decompression. So they're
Mhm.
chilling under that light, one over each table. For
You have the light over the decom table.
I do. Yep.
That's cool.
So what we'll do is I'll have our boy Mr. Cooper drop some pictures of our setup.
Yeah.
Right, we'll try to get the setup of Decompville
Love
as well
to.
as my setup and just show people what we're doing with decompression and some of
Okay.
the technology we're using.
I love
But
it.
that's what's up. All right, so we've got the magical story. We've got full resorption of this like almost 2-inch extrusion,
Yeah.
and then you started looking at number 2, the second
Yes.
one there.
Number 2, we were talking about the date. That's how we got to your open house.
Yes.
Yes. So the date of this MRI is 1/11/24. That is 8 days ago.
Mm-hmm.
Okay. This patient, young, she's 38, 37,
Man.
and went to the gym. This is so common. I know you're seeing this too. I've had back pain before. I'd have it. It was kind of debilitating for a few days, and then it would go away. Then I'd exercise. I'd be with my kids. I'd sit at work all day, and I'd get an episode once a year. And then the last few years, my episodes are coming more frequently, so twice a year. And instead of the short window of 3 days, right, they're lasting a week. So more frequently, and then longer duration of time. There is an underlying disc bulge there. That patient has a disc bulge, herniate. They got some disc issue.
For sure.
So this patient, that's the story. Then this last episode she had at the gym, felt that pop. She was in bed for a week. She couldn't walk. She was slanted sideways, as you're talking about with your patient. She brought the MRI to me, and the doctor's like, oh, you are going to probably need an injection, and then you're probably going to need spinal surgery. That is your option. That's what we can offer you.
Oh, man.
So
it's so common to hear.
That's all it is.
It's literally, it's a 3-page book. Page 1, beds. Page 2, injections, PT. Page 3, surgery.
That's it.
Page 4, we don't know what else to do.
Yeah, that's the option.
Yep.
So she saw us through our testimonials online. That's why I'm big in social media, big about telling our story.
Show me that shirt. Pull that up just so people know what we're looking at.
Just so I want to give people the option. Oh, we're seeing what's on here.
Yeah, there we go.
8 weeks later, 100% better.
Interesting.
Comes in slanted, crooked, antalgic lean, pain down her leg, into her butt, knee, into the foot. She has 2 young kids, can't pick up her kids, not in a good headspace, the emotional component, can't exercise. Obviously, the relationship at home is altered because she's not doing well, all aspects of her life. 8 weeks later, 100% improvement on pain. She's doing Pilates, she's exercising, she's playing with her kids. Her relationship is much better because she's in a better mental headspace.
So real quick, a question that some of these folks ask is, well, it usually goes away in a couple weeks anyway, right? So what do you tell those folks? They're like, oh, this is a common thing, but I'm just tired of it happening.
Well, to this point of this patient, it's happening more frequently, as we said, and it's lasting longer. So during our consult, I used to have this, it would be 3 times, it would last for 3 days, and now it's lasting a week and it's still not better. I said, yeah, so it could resolve itself, but also your life is miserable right now. So we should take action to resolve this. And if we don't, you'll probably get better in a few weeks. You'll be asymptomatic, but that I'm looking at the report, that 1.2 centimeter disc bulge that you had is not resolving itself. So I'm in the line of work where I solve problems and I fix problems. And I'll just help you get out of pain and live your life, which is our goal, but I fix problems. So I can say that confidently. When I fix a disc bulge, the disc bulge reabsorbs. That's what happens. You fix it. So just present to the patient. Do you want to fix the problem or do you want to mitigate the symptoms? And
hold up, JD.
I can almost guarantee you it's going to come back. And this patient had a protrusion. And the thing about her is, as we were getting into, she was having flare-ups. As most patients will get a flare-up once a year, only 3 days. Then the next year, I had 2 flare-ups. Then the year after, I had 3 flare-ups and they were lasting a week. Like, these flare-ups are happening more often.
Yep.
And they're also happening and being longer in duration. They're harder to get over. And you were asking about, well, why would someone come? Why not just wait the 3 weeks for the flare-up to resolve? Because the flare-up gets so bad that eventually the meds and whatever aren't helping, that these people can't function. I mean, she couldn't walk, and it's been like that for a week. So something got to give. So treatment's needed from their perspective.
That's a tough case, right?
Well, it should be.
So is this the post MRI that we're looking at?
So I'm looking at the post MRI.
1.2
centimeter disc bulge. disc protrusion, sorry, at the L5S1, the most common site for low back issues. MRI was 1/11/24. That was 8 days ago from filming, fresh off the press.
Bring it up a little bit. Bring it up. Bring it up. There you go.
48% resolvement or reabsorption of the herniation.
That's incredible.
48% in 3 months.
That's incredible.
It's amazing. Her life is completely changed. Her relationship with her husband's better because she's, mentally she's there. She's not fighting the chronic pain. Her relationship with her kids are better. She's not snapping at her kids. She has more patience. She's able to pick them up. Her mental clarity is better because she's able to exercise and do Pilates and do walks and do things with her friends and socialize. And her family as a unit's better because she's able to work again and bring income to the family.
Mm-hmm.
The whole situation is a home run.
That's badass. That is
really
such a cool case. And how many more of these cases would you say you have over the last 2 years?
Pre and post MRIs?
More the outcomes.
Outcomes, hundreds to thousands. Thousands. It's amazing. Thousands of cases.
That's freaking-tastic, man.
I get chills.
Yeah.
I get chills. And you know why? To circle back on why I do this, I'm going to close the loop on that. When I had my disc herniation at my L5S1, it was 5 millimeters. And the problem was the term they use in the reports are abutting the nerve, meaning it's on the nerve root, which tells you that the patient probably has constant, unrelenting pain. So the pain's always there. It might be diminished in volume, but it's always there. My pain was always on my left leg. I couldn't walk. I couldn't sleep well. I couldn't work. I was mean. My pain was bad and I was mean. I just didn't have the space. Found decompression 7 weeks later, my pain was completely resolved in 7 weeks. And so I had this engine, right? This piece of equipment that I didn't know what to do necessarily. And we were running to the chiropractic side of patients that were, they're 70% better, but they're not 100% better. And I was like, hey, let's try the decompression table. Let's try and see if it helps you. Within 2 weeks, they were 100%. So some momentum started building and people were talking around town. And all of a sudden I was getting referrals from other chiropractors for disc bulge patients that they couldn't resolve. Well, then I needed a second table, and that's how Decompville was grown out of my own personal need for the table, my success, and then the success that we've had with thousands of patients to where I'm going to have 8 tables, which is insane.
Yeah. That's awesome, man.
That's the story.
Awesome. So you got number 8 on the way?
I am getting 2 tables.
Oh, bulk order.
I'm getting 6 and 8. I'm sorry, 7 and 8.
Just even number tables.
I have 1, 4, 5, 1, 2, 3, 4, 5, 7. I need to get 7. Yeah.
Well, that's awesome. So, I know that you went through that rough time. You couldn't play basketball. You still ball every week, right?
I ball every other week. Every other week I play.
Okay.
Yeah.
I know that, you, myself, and a couple other doctors are also doing decomp at a pretty good level. We're chasing you for sure, but you better be chasing somebody. So if you're the smartest one in the room, sometimes you need a new room. But
yes.
You were able to host us out in California for what we called the Decomp Open, I believe it was 1.0.
Decomp Open.
Decomp Open. Yeah. So I'm really looking forward to that second Open. Hopefully I get the invite. And what's the table minimum? Is there a table minimum to be invited to this?
The Decomp Open is a way for decompression experts like yourself and the doctors that we're discussing to go out for a weekend, have a casual time where we can talk about decomp, different challenges, different like the red and blue light that you're describing. Maybe that would be, we could discuss that, and other practitioners would use that to help with their decompression patients to get better outcomes in a very casual setting. So we had almost 8 people last time. I'm going to try to get 20 decompression doctors, and that's going to be in the summer or fall of 2024.
Excellent. Excellent. If we go to California, I vote summer. If we're in
Yes,
Arizona,
it won't be summer in Phoenix.
Yeah, definitely not summer in Phoenix. Anything to get me out of here.
Good tan though.
Oh, I'll try working on it. Working on it. Well, cool. I assume that questions are always welcome at these Decomp Opens, right?
Yes.
Always welcome. That's how we learn.
You don't know unless you ask a question.
Got to ask questions.
So,
we could talk for hours and hours on this. The question that I have is for people that listening, because it's a question I always get, and it's usually in the beginning, right? Hey, so what if this works really well? What do I do then? I don't want this to come back. What is like a maintenance? Do you do maintenance? Do we do graduated care? What kind of stuff do you do there?
Yes. I'm going to hold my pen. Okay. What happened to my pen? It fell. Why did it fall?
I'm going to go with gravity.
Gravity. We're sitting here chatting. Having a great time, by the way. Thank you for having me.
Excellent time, minus this IT stuff. But yeah, great time.
It allowed me to have a little snack. What's happening to our spines right now?
Oh, geez. Are they compressing?
They're compressing. So naturally, our spines are compressing. The stabilizing muscles in our body are fatiguing every day because of gravity.
Is this why people older in age tend to be shorter? Or they literally measure shorter than they were earlier in life?
Yeah, their postural muscles and their spine, the fluid is degenerating. It's wearing out. And so they literally will be 3/4 to an inch shorter. And then you naturally your posture leans forward because the postural muscles don't stabilize as well. So you will shrink. Yeah.
So what's your recommendation for some of these cases that have gone through this?
I won't tell a patient to do anything that I wouldn't do. So leading that is I get on the table every 2 weeks. Now that's based on me, my symptoms, my moderate to slight arthritis at my L5-S1 from sports, and my case. Some patients that are similar to me might need 2 to 3 weeks. Some patients that are younger with no arthritis, they may need 6 weeks or a quarter. So 3 months.
Yeah.
On the other side, if I have a patient, I'll tell this story, short story.
Bring it.
He's about 70 years old. He's going to be on my podcast in a few weeks. And he has really severe DISH. For the listeners and viewers out there, DISH is a condition where the spine degenerates and there's a lot of arthritis and calcium deposits around the spine. It's very brittle, lack of flexibility in the lower spine. Basically, it's a patient that has pain, very rigid and stiff, and doesn't move well. That's what we'll categorize as without being too specific. Was that an okay description?
Yeah, I mean, that's like 50% of the people out there. So yeah, very easy to understand.
And he had really bad disc bulge, bad sciatica. He was resolved with his symptoms within 7 to 8 weeks. Great story. He comes in once a week. Because how bad and arthritic his spine's not healthy. So we're trying to just prevent bad things from happening to his spine. We're not really going to be growing the spine stronger and more resilient. We're just trying to prevent it from getting worse.
Yeah.
So a patient like that, we saw yesterday for his maintenance every week. And he was telling me, he held my hand, great guy, his name's Jay. He's like, Dr. Dudum, I don't know what my life would be like without spinal decompression. I don't. Awesome. I come in here, I feel great. I'm able to do what I want to do. And I don't know what my life would be like without decompression.
That's awesome.
And that adds fuel to my fire, to your fire, to just tell the world about this amazing technology that, 99% of people write off without even trying.
Yeah, it's pretty, spinal decomp is very powerful. You know, if we didn't take the leap and become chiropractors, right, that was like a ticket to the game,
Yeah.
and ticket to the game in order to help people at this level. And luckily, a lot of people ask, why did this happen to me? Right. So,
Mhm.
kind of my story, I'll make mine cliff notes, but ultimately it was, I was going through the neuro program. It just made sense to me. Right before graduation, I was in a car accident, as well as probably about 6 months after that, I was back to kind of doing my whole thing, and I was in jujitsu, and I actually got another concussion right before part four boards, and that impacted me for about a year. And so
For a
my
year?
for a year. So I would have to take a nap every day for the first 9 months of practice. And so this was about 3 months before I got my license.
You were
Um,
practicing,
I was practicing, and I was
okay?
still dealing with like chronic fatigue stuff. I was dealing with that dysautonomia type of feeling where as I stand up, I get more like lightheaded. My heart starts pounding a little bit.
Yeah.
So yeah, so I was dealing with dysautonomia issues, the lightheadedness, the kind of the brain fog, the issues with focus and attention, and certainly like stamina of paying attention and just working all day. I'd
Yeah.
have to take a nap every day at lunch to be able
Wow.
to make it through the afternoon. And then fast forward more, like with low back issues, I had that pars fracture you were talking about earlier. So I had a
When did that happen?
bilateral. That happened back in middle school, so between seventh and eighth grade.
Okay.
And so it was baseball. It was just a crazy weird pitch. It was a weird move, and I felt it go. I lasted maybe another 2 minutes trying to run the bases, and I had to come off the baseball field.
Wow.
And so spent the rest of the day in a bus waiting for everybody else to get done. And that was while I was at a summer camp for baseball up in Telluride, Colorado. That happened on day 2 out of like 6 days. So that sucked. But what happens with me is if I'm not good about my core activation,
Mhm.
then I will get significant right-sided SI and like hip pain. And occasionally I'll get stuff down to my big foot or my big toe. And so for me, I brought decompression in, number one, to help other people. But as I get on it, it's like I don't have those problems anymore.
That's awesome.
They'd be very that my personal maintenance program is like once a month. If
Okay.
I do it once a month, I'm golden. If I'm not doing it, I do
Perfect.
it a little more during football season because I'm a couch surfer on Sundays watching some football. But other than that, I really wanted to make sure that I know exactly what it feels like when I treat my patients with it, and then get them in the right mindset to make sure this doesn't come back for them.
So, are you once a month? Are the patients that you're typically like, what's your typical patient? What do you recommend for them? It varies, I
So
know, but
as we go through the program, I usually do anywhere between 8 to 12 weeks. And so if I
okay.
do an 8-week program, then I do a maintenance program that drops from say 2 to 3 days a week down to once a week. And then
Mhm.
we start spacing it out. We try 2 weeks after that, then 3 weeks after that, and 4 weeks after that, up to 6 weeks. And usually in those real acute or really bad, like degenerative cases, they start flaring at the longer you go. So we just reduce it to where their body kind of says, hey, this is a perfect amount. Other people, it's like, listen, this is so bad. I can tell you right now, you're not going to last 2 weeks without this. But generally, I'll go roughly 14 visits over the course of 6 months, and that comes out to roughly every other week. And if somebody is doing better than that, then I can stretch that out to 8 to 12,
Yeah.
8 to 12 months.
So you go similar to what I do. You go weekly and then 2 weeks. Hey, everything's
Uh-huh.
great. Go to 3, go to
Yep.
4. And sometimes they say, hey, between visit, I don't know. I felt like I needed you a few days ago. Then
Yep.
3 weeks is your spot for now.
Yep.
Yeah.
Exactly.
Yeah.
Exactly.
Similar way.
So Doc, I think this has been a super great podcast, very,
It's
very
fantastic.
educational. Um, you know, I'm sure we can talk again. We also did a podcast back on your podcast
Yeah.
a couple of months ago. And so if you guys are really looking to find out more, if people are looking to find out more about what you're doing
Mhm.
in the specialty and being, what experts do with decompression, how are they going to find you?
Great question. Few different ways. My website, drjdudum.com, DRJD, and then DUDUM. I'm sure we could plug it there. Cooper can do his thing.
Absolutely.
Instagram, Dr. Dudum, YouTube, Dr. Dudum, and then the podcast, if you want to hear more stories, Dr. Teams was on our podcast, as he said. It's Back at It with Dr. Decompression, and
That's such a cool
we're on
name.
Spotify and iTunes and YouTube as well.
Right on. Very cool. So Instagram, Facebook, LinkedIn, TikTok, all
Everywhere.
these things, yeah, everywhere.
If you can't find me, there's a problem.
Well, that's for the blind patients, right? We gotta
Yes,
get them something. No,
you gotta find us.
well, awesome, man. It's been awesome having you on.
Thank you for
I have a
having me.
feeling we're gonna get together in the future and talk more of these pre and post MRI cases. The more
Yes,
studies get done, I'd love to be a part of that. I'll share some of mine the next time as well.
awesome.
Um, Man, I'm just excited for what 2024 brings. What about you?
Very excited.
Awesome. All right, Doc. Well, thank you so much for your time, especially your expertise. You're a natural, just discussing everything that you love, what you're doing. I hope you have an awesome year, and we'll catch you next time. All right,
Thank
everybody.
you.
Thank you so much for listening in to another episode of the NeuroReset podcast. I'd like to thank any of our sponsors like XTI, any of the PillowEyes might be over there, maybe some brain BioFreeze on Dr. Dudum's end.
Yep.
But stay tuned. Go check us out at desertbrainandspine.com, Instagram, Facebook, Desert Brain and Spine, YouTube, Desert Brain and Spine. You can watch these on YouTube and listen all over Spotify and Apple Podcasts. So we thank you so much for listening, and we'll see you guys next time.
Thank you.